Hello, my name is Banka. I'm a research fellow here in the School of Nursing and Midwifery, Trinity College, Dublin. And in today's presentation, I'm going to discuss the parameters of incubation period for COVID-19 using a scoping review. This is part of a larger study, and the scoping review is step one of many in order to provide estimates of number of people who are asymptomatic in Ireland and who remain undiagnosed. Later today, Professor Comiskey will present on the hidden estimates of COVID-19 in Ireland. The team comprises of myself, Professor Comiskey, Dr. Anne Snel, Dr. Katie Tobin, and our collaborators from the Health Protection and Surveillance Centre. This project has been funded by the Health Research Board and the Irish Research Council. To define the incubation period, the European Centre for Disease Control provides a simple overview of infectious disease epidemiology definitions at the different stages of infection according to time. The period between exposure and onset of clinical symptoms is called the incubation period. The host may become infectious at any moment of the infection, and this moment will vary per pathogen. Early estimates of the incubation period of the emerging COVID-19 virus were reported by Banka et al. In Wuhan on the 27th of January 2020. The authors reported that within the cases observed, the incubation period was estimated to be 6.4 days. Following on from this early estimate, Li et al. Reported a mean incubation period of 5.2 days in Wuhan, and Lau et al. Also reported the median of the incubation period of 5.1 days in China. Further individual studies in Europe by Burma et al. Have shown that the median period was 4 days with an interquartile period of 2 days. Within Saudi Arabia, it has been shown that the incubation period can be 6 days. Since these early studies, numerous further individual case notifications and modeling studies have emerged, estimating the period to range from 1 to a maximum of 34 days. However, to date, no scoping review or meta-analysis has been conducted on the results of these individual studies with the primary objective of quantifying the mean and the standard deviation of the incubation period for the purposes of modeling its distribution. When an epidemic can produce both asymptomatic and symptomatic cases, the identification of the numbers infected becomes more challenging. Mathematical modeling of the effective reproductive number R of an epidemic, the number of infection, and the subsequent decisions on planning and mitigation is fully dependent on accurate and up-to-date estimates of the key modeling parameters. To aid this process, we conducted a scoping review and meta-analysis of the parameters of global incubation period of COVID-19. Our ultimate aim was to provide an up-to-date estimate of the incubation period distribution to aid ongoing modeling estimates of the effective reproductive number R and subsequent estimates of the hidden prevalence of asymptomatic cases. A scoping review, as many of you are already aware of, is a method of rapidly mapping concepts underpinning a research area. This allows us to summarize and disseminate findings and to identify research gaps. Understanding the incubation period distribution is the foundational building block for modeling the spread of COVID-19. And that's why the aim of the review is to provide an updated estimate of the incubation period distribution. In relation to the methods, it consisted of searching 6 main databases, which included Snel, Medline, PubMed, Embase, ASIA, and the Global Index Medicus from the WHO. We searched for articles dated between the 1st of January 2020 to the 27th of July 2020. We did not apply any other restrictions, including language. Prior to conducting the search, advice was sought from the Trinity College librarian. Studies were included if they presented data on COVID-19, that is, original study data on COVID-19. There were various study designs which were included, and these are case studies, multi-center studies, case series, prospective cohort studies, web data mining, cross-sectional studies, and individual case reports. In relation to data analysis, we focused on two main types of outcomes. These are the primary outcomes and the secondary outcomes. Within the primary outcome, we extracted means of incubation period with its standard deviations and confidence intervals. The secondary outcomes included the 5-number summary. These are the minimum, the maximum, range, median, interquartile range. But we also extracted any additional confidence intervals that were provided by the researchers. We also used what is known as the central limit theorem. This allows us to compute the pooled mean and the pooled estimate of variance and standard deviation. On this slide, we will discuss the gamma probability density function. As I've mentioned before, the purpose of the study is to provide an estimate of the incubation period distribution. The review provided the parameters that can be used in the gamma probability distribution, and this is considered the most commonly used distribution for incubation periods. These parameters, when applied to the gamma distribution, allows us to model the incubation period and, using a back calculation model, to provide estimates for asymptomatic cases. However, this is the next step of the study, which Professor Comiskey will discuss in her session later today. As you can see on the diagram here, 1,084 records were identified through the database searches, and 1 article was sourced through manual searches. After duplicates were removed, 858 articles were screened, of which 689 were excluded based on the title and abstract. 169 full texts were then assessed for their eligibility, of which 105 were excluded for various reasons listed here. In the final stage, 64 articles were included in the review and synthesis. When all of the data were pulled together, there was a total sample of 45,151. The age ranged from 0 to 90, with a median of 43 years. The minimum ranged from 1 to 9 days, and the maximum incubation period ranged from 4 to 34 days. The median incubation period was 6 days, with a pooled estimate of mean was 6.71 days. We also have a pooled estimate standard deviation of 4 days. The 95% confidence interval ranged from 1 to 12.4 days, and the interquartile range was from 1.8 to 16.3 days. This slide shows a forest plot with all of the means, including the mean of means, which is highlighted in red, and this is placed at approximately 6.71 days. So, what this review adds is a pooled estimate of 6.71 mean days with a standard deviation of 4 days, and the confidence intervals ranged from 1.8 to 12.4 days. It provides the parameters for a gamma distribution to model the incubation period. There were some limitations, and these included the lack of publication of mean days and standard deviation. Also, quality of some of the studies were lacking. However, this was outside the remit of this review due to its rapid nature. To conclude, governments are planning their strategies on a maximum incubation period of 14 days. While our estimates shows an average of 6.71 days of incubation, what we also found when reviewing the 64 articles was the variability and the potential for further incubation beyond 14 days. For example, one of the studies reported a maximum of 34 days, which shows that there is an ongoing need for detailed surveillance on the timing of self-isolation periods and related measures for protecting communities. Thank you for listening, we are happy to take questions.